So welcome guys. Um, in today's session, we'll be looking at a review of Autacoid pharmacology. And first of all, okay, let me this is misbehaving. What are Autacoids? Now, Autacoids are endogenous substances which have complex physiological and pathophysiological functions and are usually produced by a wide variety of cells, and and they they act in an autocrine and a paracrine function. So they are endogenous substances. Okay, so endogenous substances which are produced by a variety of cells. They act locally at the site of production, either in an autocrine or a paracrine function. Remember that. So under autacoids, they are either amines, lipids, or vasoactive peptides. Now, amines are histamine and serotonin. Now, under the lipids, we have the prostaglandins, leukotrienes, thromboxanes, platelet activating factor, and the peptides, they are vasoactive, so they have their effect on the blood vessels. So they can either be vasoconstrictive or vasodilate. They are either vasoconstrictor peptides or vasodilator peptides. So they are vasoactive. So, but today we just focusing on histamine. Okay, so histamine is usually synthesized from the amino acid histidine by an enzyme known as histidine decarboxylase. You just decarboxylate histidine and get histamine. Then it is usually stored within the storage granules of mast cells and basophils. Okay, now it mainly acts on H1 and H2 receptors, but we have other receptors, the H3 and the H4 receptors. Now, the H1 receptors are found in the first of all histamine receptors are G protein coupled receptors. Okay, so H1 are found in the smooth muscles, the endothelium, and the brain, and it is GQ. What do I mean by GQ coupled? So its activation will result in the cleavage of phosphatidylinositol to liberate inositol triphosphate, which acts on the smooth endoplasmic reticulum to release calcium. Okay, so it is GQ coupled. H2 are GS coupled. GS in that its activation will result in the activation of adenylate cyclase and result in an increase in the cyclic AMP in the cell. Now, and the H2 receptors are found in the gastric mucosa, the cardiac muscles, also in the brain. Now, H3 are autoreceptors, presynaptic. Okay, they are presynaptic autoreceptors and heteroreceptors, and they are found in the brain. Okay, so and they are GI coupled. GI means its activation will result in the inhibition of adenylate cyclase, hence decrease in the cyclic AMP. Now, H4 are also GI coupled, okay, and they are mainly found in the hematopoietic cells, the eosinophils, your neutrophils, mast cells, also the CD4 T cells, okay. So, histamine, how is it excreted or metabolized? Histamine is usually converted into imidazole acetic acid, IAA, under the action of monoamine oxidase and the diamine oxidase. So in in uh, in tumors where there is increased histamine production, this can be investigated by increased levels of imidazole acetic acid in urine. Okay, so what are some actions of histamine? It causes dilation of small blood vessels and hence can result in flushing and hypotension. Now, falling blood pressure will be mediated by both H1, the early response, and this is due to release of nitric oxide. Then the delayed response is mediated by H2, and it is H2 by histamine acting on H2, which are found on the smooth muscles of the blood vessels. Okay. Also, it increases capillary permeability and results in edema, that is mediated by H1. Also, intradermal injection may result in triple response. Please understand this, the triple response, which will consist of a red reaction due to vasodilation, a wheal, which is due to exudation of fluid due to increased permeability. Remember, permeability we said is due to H1, and the flare response due to which is a spread in redness due to the axonal reflex, and it is primarily a H1 response. Okay, so the triple response is a H1 mediated response. Now, H1 receptor stimulation has a negative dromotopic, which means it decreases AV conduction in the conduction system of the heart, whereas H2 increases the force of contraction of an isolated heart. However, the effect on intact heart is not prominent. These effects are mainly on isolated heart. Now, okay, these side points here, you can be reading them. They are just a summary. Histamine is a powerful contractor of the visceral smooth muscles through the H1 receptors, and it will result in bronchoconstriction and abdominal cramps. Now, histamine increases gastric secretion by stimulation of H2 receptors. Now, histamine is, apart from the mast cells, other cells which contain histamine include the enterochromaffin-like cells in the gastric mucosa, and this will release histamine, which will act on H2, stimulating the release of gastric juices. Now, it also stimulates nerve endings and will result in pruritus and pain, H1 mediated. Pruritus is like itching. Now, histamine is synthesized within the brain. Which part of the brain, to be specific? The TMN nucleus, the tuberomammillary nucleus, found in the posterior hypothalamus, to be specific, the tuber cinereum. Okay, and histamine usually stimulates the reticular activating system and maintains wakefulness, mainly through the H1 receptors. So you can tell, if I block the H1, I will induce a state of sleep. Okay. Now, H3, we said they are the presynaptic autoreceptors and heteroreceptors in location. Inhibit, so H3 receptors inhibit release of histamine. So inverse agonist refers to a substance which, when bound to a receptor, it induces an action which is opposite to that of an agonist, where an antagonist has affinity but no potency. Okay, so H3 inverse agonist can, so if you block H3 receptors, there will be increased release of histamine. So they will increase histamine release, leading to a state of wakefulness. So we have a drug known as pitolisant, or the same drug is also called tiprolisant, which was developed, I believe, in the year 2016, is a drug approved for narcolepsy. So patients who have narcolepsy can be treated using that H3 receptor inverse agonist. Now, it also serves as a mediator of inflammation and the immediate type of hypersensitivity, the type 1. Okay, so release of histamine is either immunological, chemical, or mechanical. So we have a drug known as beta histidine, which is an oral histamine analog, and it is used to control vertigo in Meniere's disease. Now, some basic drugs. This is the chemical mediated release of histamine is mediated by the following drugs: tuberculin, morphine, atropine, vancomycin, polymyxin B, may result in histamine release. So please note that. Remember, the release of histamine from the mast cells is immunological or mechanical. So immunological is mediated by the IgE, also mechanical release during physical trauma. Now, H4, I said that present in the hematopoietic cells like in eosinophils, basophils, and mast cells, and they promote chemotaxis. Antagonists to these H4 receptors are being developed, and they will prove very useful in allergic conditions. Now, remember the intradermal injection of histamine. I said the triple response. You will have a red reaction due to vasodilation, a wheal due to exudation of fluid due to increased permeability, flare due to which is a spread in redness due to an axonal effect. And remember the triple response is an H1 mediated response. Now, H1 antihistaminics. These are drugs that act as competitive antagonists at H1 receptors, and they may be classified into the first generation and second generation on two bases. One, their CNS penetration or their anticholinergic properties. So let's go to the first generation. Why first generation? One, they can penetrate blood-brain barrier. So they are centrally acting, and therefore they will result in sedation and psychomotor impairment. Why sedation? Remember, I told you histamine being released from the tuberomammillary nucleus promotes wakefulness. So if you block the receptors, what will you do? You will induce sleep or sedation. Now, therefore, these drugs are contraindicated in persons requiring constant attention. So you cannot give these drugs to truck drivers. You don't want them to cause accidents. You can't give them to machinery operators. You don't want them to injure themselves. And also swimmers. Imagine giving a swimmer a drug which is inducing sedation, and he or she goes to swim, they will drown. So avoid in those category. So they will induce sedation. Another property of the first generation is that they have anticholinergic activity. So first generation, they penetrate the blood-brain barrier, so they are centrally acting, and they possess anticholinergic activity. Now, due to their anticholinergic activity, they have a wide spectrum of uses. However, adverse effect, okay, like anticholinergic activity will induce a dry mouth, urinary retention, constipation, okay? So these first generation are of three categories. They are either highly sedating, moderately sedating, or mildly sedating. So we have this diphenhydramine and dimenhydrinate as some highly sedating. Then you also have promethazine, then hydroxyzine and doxepin. Okay, so please remember these three highly sedating. Those are the ones, in fact, I can contraindicate the most in the truck drivers, for the machine operators. Okay, so this for those interested, these two, the first two here are ethanolamines. Okay, then promethazine itself is a phenothiazine derivative, and hydroxyzine is a piperazine derivative. Then moderately sedating, we have phenyramine, cyproheptadine. Please remember cyproheptadine. Then you have meclizine, buclizine, and cinnarizine. Okay, so just like hydroxyzine, meclizine is also a piperazine derivative. Now, the mildly sedating, you have your chlorpheniramine, piriton. I know this one. This one you use, and you use it for the wrong purposes. So for those guys who cannot sleep, they take this, which is okay. You understand the basis why it will induce sleep, okay? Because it is a first generation, so it can penetrate the blood-brain barrier, resulting in sedation. Okay. Then we have like pyramine, cyclizine, which like meclizine is a piperazine derivative. By the way, chlorpheniramine is an alkyl amide. Okay. Then you have your cremastine. Okay. So Please remember at least two in each of these. Okay. Okay. Now, uses of the first generation. Now, based on their antihistaminic, their H1 blocking activity, they can be used in allergic conditions such as itching, urticaria, hay fever. Okay. Also, to treat insect bites, some insects contain histamine in their stings, IV poisoning, and also to prevent adverse effects due to histamine releases. Some drugs like I told you, morphine, tuberculin, atropine can induce histamine release. So as to prevent these adverse effects, you can use these antihistaminics, the first generation. Okay, then based on their anticholinergic property, you can use them for common cold, such as so as to control the rhinorrhea, a runny nose, motion sickness as prophylactic agents. Remember, a good drug to use for motion sickness was hyoscine, your scopolamine, which you should take prior to the travel. Can also be used to treat Parkinsonism, especially promethazine is the preferred one. So remember P for promethazine, for Parkinsonism. Now, acute muscular dystonia. Other uses, antihistaminics may also be used. They are the drugs of choice for idiopathic pruritus. So patient has constant itching and you cannot tell the cause of that. So antihistaminics will be a drug of choice. Also, in the treatment of vertigo, you can use the moderately sedating first generation drug, antihistaminic drug known as Cinarizine. Okay. Now, what are some? So this is a mnemonic which you can use. So since they based on their uses of H1 blockers, based on their anticholinergic, so they possess anticholinergic properties. So P for Parkinsonism, remember P promethazine, anti, this A, acute muscular dystonia, C, common cold to control the rhinorrhea, also P for prophylaxis of motion sickness. Now, adverse effects. It is based on their first, their anticholinergic effects. They will cause a dry mouth, blurred vision, urinary retention, and constipation. They also cause sedation because they penetrate the blood-brain barrier. Psychomotor impairment, the same. Now, doxepin is a tricyclic antidepressant which has the most potent H1 blocking action. So it is 800 times more potent than diphenhydramine. So you can see how powerful it is. Now, second generation antihistaminics. So based on their CNS penetration, they have little CNS penetration because they are hydrophilic. First generation, they were lipophilic, so they can penetrate the blood-brain barrier. But second generation are hydrophilic, they cannot. They have little CNS penetration, so they do not cause sedation. How does that mean? You can use them safely for people where constant attention is required. You can use them for truck drivers, machine operators, swimmers, okay? And they do not possess the anticholinergic activity, so the adverse effects such as a dry mouth, urinary retention, constipation won't be a problem here. Now, some drugs like cetirizine and azerastine, they possess additional anti-allergic mechanism. Apart from being antihistaminics, they possess other anti-allergic mechanisms, which I'll be telling you in Hawaii. Now, these drugs lack sedation, so because they have little CNS penetration, can be used safely for the truck drivers or people who require constant attention and anticholinergic effects, but their use is also restricted to anti-allergic effects. Now, some of the important drugs in the second generation antihistaminics include one, difenadine, which is the fastest acting antihistaminic drug. Now, overdose of difenadine usually block the cardiac delayed rectifier calcium channels. By doing so, it will result in the polymorphic ventricular tachycardia, what is known as the tosoids, the pointers, which is manifested as a prolonged QT interval. Okay, remember the QT interval represents ventricular depolarization and repolarization. So if it is prolonged, the rhythm of the heart will be lost. So there will be an arrhythmia. Okay, so what is use of this drug, therefore, the tafenadine, with microsomal enzyme inhibitors such as your ketoconazole, erythromycin, clarithromycin, and itraconazole, usually increase the risk of this arrhythmia. Okay, the tosoids, the pointers. So this drug is usually metabolized by the CYP. So if you use CYP inhibitors, there is a likelihood that there will be an overdose. So patients taking either ketoconazole, erythromycin, clarithromycin, and itraconazole shouldn't be given tafenadine. However, tafenadine is usually metabolized to an active metabolite known as fexofenadine, which is available as a separate drug that lacks the calcium channel blocking property. So fexofenadine, which is the active metabolite of tafenadine, does not cause the tosoids, the pointers, but tafenadine will do. Also, astemizole is the slowest and the longest acting, and also it also possesses the arrhythmogenic property similar to tafenadine. So it also, astemizole will produce the tosoids, the pointers. So therefore, it should not be administered with ketoconazole, erythromycin, clarithromycin, and itraconazole. Okay, because astemizole is also metabolized by the CYP. So any microsomal enzyme inhibitor is likely to cause an overdose. So read this: tafenadine and astemizole result in polymorphic ventricular tachycardia. The tosoids, the pointers, which is manifested as a prolonged QT interval on your EKG. Now, loratadine is another long-acting second-generation antihistaminic and is usually metabolized to desloratadine. Desloratadine is the active metabolite of loratadine, and desloratadine is available as a separate drug. Now, cetirizine is the active metabolite of the first-generation antihistaminic hydroxyzine. Remember, I told you hydroxyzine is a strongly sedating first-generation antihistaminic. Its active metabolite is cetirizine, which now is the second generation. So hydroxyzine is lipophilic. Cetirizine is hydrophilic. Cetirizine has little CNS penetration as compared to its parent, if I can call it the parent drug, hydroxyzine. Now, note this: all second generation antihistaminics are usually metabolized into active products except cetirizine and mizorastine. Okay, so only cetirizine and mizorastine aren't metabolized to active products. Now, cetirizine possesses additional anti-allergic mechanism, like one, it inhibits the release of cytotoxic mediators from platelets. Okay, and also it inhibits chemotaxis. So apart from being antihistaminic, its other anti-allergic effects are these: inhibiting the release of cytotoxic mediators from platelets, and also inhibits chemotaxis. Now, some persons acquire sedative effects with cetirizine. Note that. Now, levocetirizine is an isomer of cetirizine, and it is more potent and less sedative. Now, azerastine, please don't confuse azerastine with astemizole. Okay, so azerastine possesses maximum topical activity and can be given. So this is a topical drug and can be given by nasal spray for allergic rhinitis. We have other second generation antihistaminic agents such as your mizorastine, ebastine, levocabastine, EDC or oropatadine. Now, oropatadine is a recently approved topical H1 antihistaminic used as a nasal spray for seasonal allergic rhinitis. Now, whereas alcaftadine has been approved as an ophthalmic solution for allergic conjunctivitis. Okay, so note this, that some authorities describe the term third generation antihistaminic. So some texts, you find some texts which have third generation antihistaminics for the active enantiomer like levocetirizine, or the metabolites desloratadine and fexofenadine of the second generation. So if you come across that generation antihistaminics, that is what they are trying to say. They are the active enantiomers or the metabolites, active metabolites of the second generation antihistaminic. So that is where we reach. Next time, I told you to keep in mind cyproheptadine. I told you to keep in mind cyproheptadine. Next time, we'll be looking at serotonin, and I will show you why I told you that. Thank you for your attention, and please subscribe for more pharmacology content. Thank you very much.